Today in the port we have prostate cancer, and we would like Dr. Moses to educate us on prostate cancer. Doc, welcome to Traditional Ports.
Thank you.
I know there is prostate enlargement and there is prostate cancer. I want you to educate us.
Well, when we talk about prostate enlargement, the enlargement could either be cancerous or it could be benign. So we have benign prostate hyperplasia, and then we have a prostate cancer. Now, what we say is benign, it only means that the prostate gland, as we age, it becomes bigger and bigger as we age. From somewhere by the age of 25 years thereabout, it starts becoming bigger and bigger. And so when it becomes big, we call it benign prostate hyperplasia. That means just ordinary enlargement. But when one cell decides, the cells that forms the prostate gland, we call them the stroma cells. When one cell decides to multiply and stop, one starts multiplying, it doesn't stop the multiplication. It goes uncontrolled. Uncontrolled multiplication is what we call cancer. Then that means the gland becomes cancerous. And that means that when you say anything is cancer, it means the thing starts multiplication. It doesn't stop the multiplication event. It follows continuous multiplication without stopping. That's become cancer. But when it's benign, every tissue in the body will multiply at some time and stop the multiplication, and it's under the control of the brain. The brain controls all the activity of the body. So all cells in the body will multiply at some time and stop multiplication. Some will die off, a new one will be produced, and that's how God have arranged it. God has made it such a way. But when we say something is cancer, it starts multiplication without stopping. That's what we call cancer.
Okay, Dr. Moses, when I heard of prostate, I thought it's a worst enemy. But upon research, I realized that prostate has a certain function in the human system. How true is that?
Yes, the prostate gland was put there purposely for a reason. And prostate gland is always found only in men. The reason why God made the prostate gland is for it to assist in reproduction. What the prostate gland does is to produce a fluid called prostatic fluid. That fluid helps to nourish the sperm and also forms a transport medium for the sperm to swim. So it produces a fluid, prostatic fluid. You know, the prostate gland, the testis, and then the penis, they are the three musketeers. They form the male reproductive organ. They are the main people that play parts in the reproduction.
You call them three musketeers?
Yes, because they are always working together. Yes, the testis will produce the sperm, and then the prostate will produce the semen. And so
which makes it more transportable?
Yes, it's the semen or the prostatic fluid produced by the prostate is a medium for the sperm to swim. Yeah. And it also serves as a source of food for the sperm to feed on and then have energy to be able to swim. And
so that means the prostate is good?
No, the prostate is very, very important in the body. It helps to take part in the reproductive system of the male organ. I mean, the male system is the male organ, that's the penis. The testes produce the sperm, and then the prostate produces the prostatic fluid, or the semen that you see with your naked eye. When you have orgasm, what you see with your naked eye is produced by the prostate. But the sperm itself you can't see with your eyes. So is the prostate that produces the semen, the prostatic fluid that you see with your eye. So it's very, very important. It becomes bigger as we age, and because of the peculiar location of the prostate gland, is located just below the urinary bladder, and the urine will have to necessarily pass through the prostate before getting to the penis, and that is what causes the problem as we age. You know, when we are aging, the passage of the urine will go through the prostate, and the prostate, when you are aging, it becomes bigger and bigger. When it's enlarging, it enlarges towards the inward where the passage of the passes. So it's like a clamp on a hose, on like a water hose which is clamped. So when it's enlarging, it blocks the passage of the urine. That causes the symptoms that we see with prostate enlargement.
Today we are fortunate to have an expert in the person of Dr. Digor, who is educating us about prostate cancer. So where is the prostate located?
The prostate is located just below the urinary bladder, from where the urine will have to necessarily pass through the prostate gland before getting into the penis. And now, because of the location, and because the prostate is enlarging, and it enlarges to block the passage of the urine, because it's going to block the passage, then if that happens, you have to strain before the urine comes. And when the urine is even coming out, it comes slowly. It doesn't flow with any pressure.
Doc, I've seen people with prostate. I've been to Kolebu. I've seen people suffering. Even the tummy. The tummy is so hard that even if just a little, like this card, touching it, they feel pain.
Yes, that is when they have retention of urine. When the urine is unable to come out at all, then it accumulates. The urinary bladder is just like a football bladder. It distends. Yeah. So when the urine accumulates, it distends the bladder and becomes like a football in the lower parts of the body. And that's when it touches. It's very, very painful. And that's when we have retention of urine. Some other symptoms include urgency of urination. That means when you feel like urinating, you cannot hold the urine. You have to quickly. You have to run and then urinate. If you don't run, you will just soil yourself in public. And others, if you finish urinating, because the flow is not so smooth, some of the urine tends to remain in the bladder, what we call incomplete voiding, so that you go and urinate within a short time, you have to go back and urinate again. So you urinate frequently during the day and also during the night. Sometimes, because you urinate frequently in the night, some people can urinate as much as 15 times in the night, so that it tends to impair your sleep. You don't sleep very well. When you wake up in the morning, you feel...
And that can also cause another...
Yes, productivity at workplace is affected. And because sometimes the urine also stays in the bladder, it tends to be infected with bacteria. So you also have what we call urinary tract infection, which also comes with its own symptoms, like urinating frequently with pain, burning sensation as you are urinating, and also have lower abdominal pain, sometimes pains in the waist. All this one are usually due to the prostate problems. Other times too, when you want to urinate, you get to the place you want to urinate, all right, but the urine will delay before coming.
That's why you see some people trying to pass urine, yes, and for like 5 minutes they are still...
Yeah, they'll be standing there. A young man will come and urinate and go away. Meanwhile, the old man is still hanging in there for maybe 10, 15 minutes before the urine will start coming. And when the urine even starts coming, it comes in drops, and to be breaking. And you'll be straining, pushing the urine hard. I mean, it's quite an embarrassing ailment if you have it. Now, that is just the benign. This benign prostate enlargement, the symptoms that I've just mentioned, can also go for the prostate cancer.
If you are the type who hardly sleep, within a night you can pass urine like 10 to 15 times. You need to go for checkup.
Yeah, that's exactly so. And we advise that once you are about the age of 35 years, you should check your prostate gland once a year. Make it a birthday present for yourself. Every year, check it yourself.
Before we come there, after the benign, you made mention of another form of...
Yes, we also have prostate cancer itself, which is the most deadly. If it's benign, it's not so deadly. If we take care of it, we can easily treat it, no matter how big it is. At Medi-Moses Prostate Center, we give you medication, natural food supplement that will shrink the size of the prostate back to normal.
So no surgery?
No surgery at all, not at all. We don't do surgery. That
is alternative form of medication?
Yeah, that's natural form, food supplement. It go back to normal size without any surgery. Now, the other form we are talking about is prostate cancer. When, as I earlier explained, the cancer means that the cells start multiplying without stopping. Now, when it becomes prostate cancer, that means it will multiply from the initial location, that is the pelvis. Then it will start moving out of the pelvis to the bones, around the pelvic bones, and then get to the back bones. Then you start having pain at your back, having waist pain. You can even move to your thighs. Then you start moving to your organs. It moves to the liver. It moves to the lung. It may move to the brain. So it starts spreading throughout the body. That's what we call cancer. Now, when you have cancer, in addition to the earlier symptoms that I've mentioned, like urinating frequently in night and day, straining on urination, having incomplete voiding, straining and having weak stream when the urine is flowing, it comes slowly. In addition to that, if you have cancer, then you see blood in your urine. You have what you call hematuria. You see blood in your urine. You start losing weight. you start losing weight, you don't have appetite to eat, you feel weak, and all these things are signs that you may have cancer. So you need to do what we call a biopsy.
Doc, someone says that if you are a man and you are urinating and the urine divides into two, the probability of you having the cancer is large. How true is that?
We cannot exactly say because the urine split into two, you have a cancer, unless we have we've diagnosed it by confirming it by doing biopsy. When we do biopsy, that's when we can confirm. Any symptoms you have could be ordinary enlargement or it could be due to cancer. So we have to differentiate between the two.
If you are a follower of traditional Port family health cancer, so now if I discover that my prostate is enlarged, what do I do? Is there any help or hope for me?
Yes, there is definitely a hope for you now that Medi-Moses Prostate Center has come onto the scene. For the past 6 years, we've been treating prostate enlargement, and we've taken care of about, for now, up to date, we've treated about 30,000 patients successfully.
That means the rate at which we are having this sickness is rising by the day.
Yes, it's now rising, and unfortunately to say, even the young ones now in their 20s, 26, 25 years, I've seen cases where they have enlarged prostates in a young man, like 27-year-old, which wasn't the case in the previous years past. We know that it's always okay when you are aging above the age of 40 years or so, but now 27 years, I've seen a lot of cases who come with a large prostate.
Doc, before you tell me if there is hope for me, I want to know the causes, so that if there are young guys out there who are watching us as at this time, if I know that I'm taking this thing, that is why, or I'm having too much sex, which is why I'm having the enlargement of the prostate, so that I'll take good care of myself. What are the causes?
Yes, the causes of the prostate enlargement, number one, the mere fact that you are born as a man will predispose you to having a prostate enlargement. A mere fact that you are a man.
That is not fair.
Yes, it's not fair, but that's how God have arranged it. Men, when we age, what you get is called prostate enlargement, or our papa pus. Women, they have their menopause, and this is our papa pus. After some age, because of the hormone that you are made of, the male hormone that makes you speak like a man, talk like a man, behave like a man, perform wonderfully in bed like a man, the male hormone, or the androgen, the male hormone, is the same hormone that has been implicated as the cause of the enlargement. It tends to feed the prostate to grow fat, to grow bigger. And so once you are a man, you are likely to, the older you get, the more likely you are likely to have prostates enlarged. And also, when you have a family history, when your father have it or your grandfather have it, your father will have it, you, the son, will have it, and your sons will have it. So it will travel along the generation to generation. All the men along the line will have it. So once your father have it, it's better for you to start checking earlier. When you are just about 26 years, start checking. Check it at least once a year. When it's enlarged, you will know, and then you can do something about it.
Doc, you continue, but before then, let me talk to my viewers. The fact that you are a man, that one alone, you can get prostate enlargement, which can also lead to cancer. So there's the need for you and I to start doing something about our prostate. Secondly, the fact that you have a family history. So if you are watching us now, just ask your father to inquire from him if there is any history of one person in the family having prostate enlargement. Because if there is a history of prostate in your family, the probability of you getting is very large.
Yes, and then now that we've also realized that the lifestyle that we lead, there are certain things that we do, the lifestyle, like excessive smoking, excessive alcohol intake, eating of certain type of unhygienic diets, a lot of intake of a lot of meat and red meat and its other products will also predispose you to having the enlargement. So
with the meat, is it because of the fats?
Fats is also part of it, and also because of the meat product, and then it breaks down the metabolic, the outcome of it breaks down can also predispose to. There are other food substances that we always advise: green leafy vegetables, green beans, cabbage, cauliflower. All this food stuff will help to delay the enlargement. It helps in dealing, and then a lot of tomatoes. The tomatoes is known to contain certain phytochemical we call lycopene, which retards the growth of the stromal cells of the prostate. Yeah, a lot of tomatoes is good, fresh ones, or tomato broth. These are all very good. Wheat is also very good. Soy.
I don't like wheat, Doc. So from today, I should start taking wheat. Those of you like myself who don't like wheat, from this show, I've understood that tomatoes are very good for men. It delays the enlargement of your prostate. You cannot get this anywhere, Doc.
That's it. So these are the foodstuffs that we advise.
So technically, we are talking about the prevention.
Yes.
I'll be allowing Doc to throw more light on the preventive measures associated with this one. But before then, let me take a short message from. Welcome back. We are talking about prostate enlargement or problems associated with the prostate. Mostly, me particularly, I thought prostate is my enemy. But from the explanation Doc has given me, I've realized that prostate is part of the reproductive organ. They are three musketeers. They work together for us. But then if you don't take good care of your prostate, it will lead to something bad. Just imagine they putting a string or a tube in your manhood. It's very painful. That is the stage where the prostate gets out of hand. So if someone already has the prostate, is there any hope, or what is the way forward?
Yes, there's absolutely a way forward. Now that Medi-Moses Prostate Center has come onto the scene, we have definite solution for that. The reason why people have rubber or catheter in their penis is that they've waited too long. And most people see the early symptoms. They don't take any action. They delay and they delay and they delay. But one day, you go for a funeral, you are happy at the funeral. By the time you realize you want to urinate, then the urine won't come again. It has ceased completely. That's what we call it urinary retention. You cannot pass the urine. Then you start wondering what is happening to you. You have to be rushed to the hospital. Then we have to insert a rubber, a stiff rubber we call catheter.
It's very painful.
That drain the urine right from the bladder to the outside before you can be relieved. So once the rubber is there, then you know that you have a problem. You've delayed too long. We advise that you don't have to reach that stage. When you take good care of yourself, when you're about 35 years, please start checking your prostate at least once a year. Go to the hospital, tell them, I want to do prostate screening. We will do the blood tests, we check your PSA, we do the scan, check the size and the weight of the prostate, so that you don't get to that stage. People wait for too long, especially when you have your father or you have a family history of prostate enlargement or prostate cancer. Please make it a point that you check it at least once a year when you're about 26 years or so.
So you made mention of, if you're a young guy, start taking tomatoes and wheat. Aside these things, what can we do, or what can the viewers do?
As I'm saying, I've mentioned certain kind of food stuffs. Green leafy vegetables are always very good. I've mentioned cabbage, kotombre, and kwansusa, those green. These are all very good for the health of the prostate. And in addition, tomatoes, soy, bean, and I've also mentioned wheat and other. These are very good. Avoid excessive alcohol intake. Avoid smoking. Avoid taking a lot of junk food, excuse me to say. And so when you avoid all this, it will help the health of the prostate. And also checking once a year. That's the mainstay. Checking is important.
Okay, Doc. So how is the treatment like?
The treatment is very simple. By the grace of God, we've formulated a natural food supplement that shrink the size of the prostate back to normal, so that all the symptoms that comes with the prostate enlargement, like frequent urination in the day and in the night, straining on urination, low flow of the urine, having some of the urine retained after urination, all these symptoms go away. Once the size of the prostate shrink back to normal, you have all these symptoms going away. And also the other thing is, because there are three musketeers, the prostate, the penis, and then the testis, they work together. When the prostate is enlarged, the other thing that some people have is sexual weakness. Some people may not have any symptom at all. They may have an enlarged prostate, but it may not come with any symptom at all. The only symptom it may come with is sexual weakness. So prostate enlargement also comes with sexual weakness. So when you have sexual weakness, you don't know the cause, come to the hospital. We will try to find out the cause of your sexual weakness, and then we will take care of that also for you. That's important.
It's very important. If you're a man, this is a program which was designed with a lot. I've learned that if you're a young man, at least try at least once in a year. Or dog
is make it your birthday present. On your birthday, instead of going out to chill in the morning, please go to the hospital, check your prostate when it's good. Hallelujah.
Someone will say, what a wow. On your birthday, I'm talking to our ladies. If your guy or your husband is celebrating his birthday, the best gift you can give to him is to take him to any hospital for checkup. Because what will it profit you if your man has prostate and it has enlarged to a stage where it has grown into cancer, where he cannot touch you? It's very boring. Dr. DeGaulle is saying that make it a birthday present, not only for the men. Our women can also assist in the process.
Women are direct beneficiaries of healthy prostates.
Yeah.
Yes, because
directly. Because I was at the mall, dog, and a group of young guys called me that they are doing breast screening, so I should come around. I was like, breast? What am I to do with breast? But they realized that we the men always have so if we can help you fix your breast cancer issues, so must you. Dog, your final words.
My final word to everybody is to please take your health very, very seriously. Don't take things for granted. The way you are today, by tomorrow it may change. The only way you can have a healthy life is to keep on doing a medical checkup. Medical checkup in our culture setting in Ghana, people don't routinely do it. In certain countries, you are even having information on your phone that your time is due to come for screening. You know, in Ireland, in other countries, they will tell you this is your time. Is due this date, you have to come for screening. So we have to make it a habit of checking our system at least once a year. The body, once you are growing, you have to be checking it. If you don't check it, you will not find certain faults that are developing. When you see the fault developing, you can easily solve it so that you may live longer.
Someone needs to educate someone for someone to educate someone. Whose responsibility is it to? Or what is Medi-Moses doing about some of these things?
Yes, Medi-Moses, we are playing our parts. We are on radio, we are on television, we are in the print media. We move from church to church, from churches to churches. We move from companies to companies. We do screening, we give education. We talk about the prostate gland and its problems, and then we do free screening. That's the function of Medi-Moses Prostate Foundation, which is just what do you call it? An arts best of Medi-Moses Prostate Center, which we came together that we need to educate the public. So we are doing it. We've been doing it for the past 6 years, and it's catching on. I think now it's catching on. Most people are now talking about prostate. If you bear with me, now most people know about prostate, unlike some few years ago where people do not know. Most people know about menopause, but not many people know about papapause, which is the prostate enlargement. Most people don't know. So we are trying our best, and we think if other people also come on board to start the education, it will go far.
Okay, so if you are a corporate body, organization, company, you want someone to come and educate your people, I don't think Doc would take anything or any money, any huge stuff.
No, it's just for free. We come and do the screening for free, we do the education for free, we do everything for free.
That is all I wanted him to say. The health show, where we talk to experts regarding your health. If you are an expert in any field of health and you want us to visit you for you to educate the general public, feel free and call us. Our producer will attend to you. And also, if you want to sponsor the program or a segment within the program, you can also call through the program. Before we go, I would like Doc to give us his final words. Today we've learned a lot. I've learned that if you're a young man, at least try at least once in a year. Or Doc,
make it your birthday present. On your birthday, instead of going out to chill in the morning, please go to the hospital, check your prostate when it's good. Hallelujah.
Someone will say, what a wow. On your birthday, I'm talking to our ladies. If your guy or your husband is celebrating his birthday, the best gift you can give to him is to take him to any hospital for checkup. Because what will it profit you if your man has prostate and it has enlarged to a stage where it has grown into cancer, where he cannot touch you? It's very boring. Dr. DeGaulle is saying that make it a birthday present, not only for the men. Our women can also assist in the process.
Women are direct beneficiaries of healthy prostates.
Yeah.
Yes, because
directly. Because I was at the mall, dog, and a group of young guys called me that they are doing breast screening, so I should come around. I was like, breast. What am I to do with breast? But they realize that we the men always have as so if we can help you fix your breast cancer issues, so must you. Doc, your final words.
My final word to everybody is to please take your health very, very seriously. Don't take things for granted. The way you are today, by tomorrow it may change. The only way you can have a healthy life is to keep on doing a medical checkup. Medical checkup in our culture setting in Ghana, people don't routinely do it. In certain countries, you are even having information on your phone that your time is due to come for screening. You know, in Ireland, in other countries, they will tell you this is your time. Is due this date, you have to come for screening. So we have to make it a habit of checking our system at least once a year. The body, once you are growing, you have to be checking it. If you don't check it, you will not find certain faults that are developing. When you see the fault developing, you can easily solve it so that you may live longer.
Someone needs to educate someone for someone to educate someone. Whose responsibility is it to? Or what is Medi-Moses doing about some of these things?
Yes, Medi-Moses, we are playing our parts. We are on radio, we are on television, we are in the print media. We move from church to church, from churches to churches. We move from companies to companies. We do screening, we give education. We talk about the prostate gland and its problems, and then we do free screening. That's the function of Medi-Moses Prostate Foundation, which is just what do you call it? An arts best of Medi-Moses Prostate Center, which we came together that we need to educate the public. So we are doing it. We've been doing it for the past 6 years, and it's catching on. I think now it's catching on. Most people are now talking about prostate. If you bear with me, now most people know about prostate, unlike some few years ago where people do not know. Most people know about menopause, but not many people know about papapause, which is the prostate enlargement. Most people don't know. So we are trying our best, and we think if other people also come on board to start the education, it will go far.
Okay, so if you are a corporate body, organization, company, you want someone to come and educate your people, I don't think Doc would take anything or any money, any huge stuff.
No, it's just for free. We come and do the screening for free, do the education for free, we do everything for free.
That is all I wanted him to say, because on traditional pots, whilst watching us, you need to get something in return, and we appreciate Dr. Medi-Moses Dobache for his time. And Doc, God bless you for accepting us too.